Good afternoon, and thank you everybody for joining us today. As you are well aware, we are going to have this session with Dr. Vijayasarathi. Before we begin, I'll just give us a quick brief and overview about Dr. Sarathi. Um, it is a pleasure to welcome all of you for this insightful session. We are honored to have with us Dr. Vijayasarathi, a highly reputed um, figure in the field of pathology. Dr. Vijayasarathi brings over 48 years of experience in academic and regulatory toxicology. Over the course of his career, he has authored more than 700 GLP tox reports, including over 28 carcinogenicity studies, spanning pharmaceuticals, agrochemicals, and biologics. Beyond this, he has mentored over 150 postgraduate students and published over 95 scientific papers. He has also served as the president of the STP India, while also contributing to global toxicological pathology committees. His experience and insight make him an exceptional guide for today's session. So I'm going to pass it over to Dr. Sarathi now.
Thank you very much, Anjali, for your introduction. Welcome all of you for this webinar on the role of pathologists in preclinical research. Now, I will be talking on what is, as I told you, the pathologist role in toxicopathology, and I will be covering toxicopathology. I am extremely happy to be present in this webinar. These are the contents of my presentation, and each point I'll be describing in detail in subsequent slides. Now, toxicopathology. Now, for a pathologist, gross pathology and microscopic changes, pathology is very important. And toxicopathology blends pathology with toxicology to evaluate how chemicals, drugs, environmental agents damage the cell, tissue, and organs. These details help in determining whether the changes are harmful, reversible, or part of the normal biological variation, including understanding mechanics aspect of the test compound. Now, pathology in safety evaluation and decision making. What happens in the what events happen in the necropsy room, and correlation. Then once the slides are in correlation with clinical data, integration of histopathology findings with clinical science and clinical pathology, and body weight changes, interpretation of finding, determining the biological significance and attributing the findings to the test article, and also risk assessment. Now, when we are doing events in the necropsy room include once after the conclusion of the study period, the animal should be sacrificed, and before sacrificing the animal, we'll be taking the body weight of the animal, followed by collection of blood, and subsequently we will be doing a thorough necropsy of the animal, looking into various organs, body cavities, and any gross pathology if it is recorded. The study pathologist will be doing this job along with the trained prosectors. And after gross pathology, some of the protocol-defined organs will be weighed, and subsequently trimming of the tissues is performed. And And ultimately, then right from the identification of lesion correlation with various parameters of the study and interpretation helps in making decision of risk assessment, ultimately giving indication of go or no go decision in drug development. Most of the pathologists are very well aware that attrition of the molecules happen very commonly, and if it happens in the initial stages of the study, then it saves not only time but also a lot of money. Now, foundational requirement for pathologists, their education, certification, and for freshers, what are the training period. Now, for education-wise, they should have a bachelor's degree in veterinary science, postgraduate in pathology. Then, if they have doctoral degree, it is an added advantage. And similarly, board certification will be added credential. Now, for freshers, then in veterinary schools, not much emphasis will be played for teaching the laboratory animal pathology. So when they come join us, they will be given extensive training under the supervision of senior pathology, both in gross pathology and also microscopic pathology. After 1 year, they will be given studies, and during that initial period, a couple of studies will be reviewed in toto by the senior pathologist. And when the senior pathologist is comfortable, they have learnt all the art and skills of pathology, laboratory animal pathology. They will be making independently for the future studies. And for them to get better training, they will also be deputed to various workshop and seminars held and also conferences conducted by STPA and also other related toxicology societies. Now, expertise in toxicopathology, now pattern recognition, distinguishing toxicity from background lesion, then interpretation of the content, and avoiding misinterpretation. The experienced pathologist I can pick up very subtle changes and also know what is considered normal for that species and strain, and also dose response relationship, including spontaneous lesion and thus avoiding costly delays in drug discovery. This is what is the art of pathology meets with the science. Now, the process from the necropsy to histopathology. I have already told you what events take place in the necropsy room, and after collection of the tissue, then the tissues will be trimmed, processed, and blocked, and sections of 3 to 4 microns sections will be taken and stained routinely with hematoxylin, and the slide quality is done by the expert in histotech before submitting it to the study pathologist. Now, this is in brief some of the pictures, collection and fixation, trimming, tissue processing, embedding, staining, and sectioning and staining. Normally, we do H&D staining techniques. And whenever we want a confirmatory diagnosis, whether, for instance, if there is a pigmentation, whether this pigment, which type of pigment, we do special staining technique like Persian blue, uh, Persian blue staining, for Gomari staining blue, and for fat we'll do oil red blue staining. And in fact, we do other staining techniques like PAS for testis section to ascertain whether all stages of spermatogenesis is taking place. And PAS is also used extensively for diagnosing polysaccharides and mucopolysaccharides. And in addition, we also do Mason trichrome stain to appreciate fibrosis and connective tissue proliferation. While H&D is our workhorse. We also do immunohistochemistry. For instance, to appreciate any proliferatory changes, we use Ki67 or BRDU. Then to appreciate apoptosis capacity, and in Alzheimer's model, we also use tyrosine hydroxylase for as a immunohistochemical technique. In addition to that, sometimes to confirm some of our diagnosis, we also do electron microscopy, and the electron microscopy facilities will not be available in all the institutions. However, we can collect tissues for electron microscopy. It's a special technique, and it should be done meticulously and clear so that no background lesion will be there. And there are laboratories which are expertise for decades in electron microscopy. We can send it to them and make it as a multi-site study. Then when we want thin sections, we go into resin sections. In resin section, we can take sections of 1 to 2 microns, and this is usually done for PNS, that is peripheral nervous system, and also for medical devices, so that any minute changes could be appreciated very well. Now, in addition to that, we also do multiple sections for certain tissues like brain, nasal cavity, then eyes, and also for nose, ovary, and heart. In heart, for if you want to study different type of changes in the various valves, we have to do multiple sections. Now, this is a picture to show liver showing fat changes. What is stained red in HND, you would have observed as vacuoles, and whether these vacuoles is what type of material is there in vacuoles to ascertain, you do a clear section and stain it, and you will be able to appreciate presence of fat. In the second picture, we are seeing articular cartilage, intact articular cartilage, and whenever there is a degeneration of the cartilage and replacement of the cartilage placed by connective tissue, this is a picture of a collagen-induced arthritis and also arthritis induced by adjuvant. The, Now, I was telling you if there is any proliferative changes, if you want to appreciate, you can do BRD staining or K67. Here, dark looking cells are the ones which are incorporated BUDU and indicating they are the proliferating cells. And here in the second picture also, the dark looking cells are the ones which are incorporated BUDU, indicating they are proliferating. Now, as I already told you, resin embedding technique, we perform for noting subtle changes in the peripheral nervous system and also for medical devices. And in the for if there is any neurotoxicant or if there is any clinical signs exhibited by the animals in life phase, like ataxia, paralysis, weakness, then we go in for, instead of normal 4 levels of section, we go in for 7 level of sections as level. And in this, the advantage is that all subanatomical locations will be clearly available for us to evaluate, like the olfactory lobe, optic nerve, then the hippocampus, thalamus, hypothalamus, midbrain, pons, and amygdala, and various layers of the cerebellum and also medulla oblongata. And you will not miss any tissue because neurotoxicant will not affect all the subanatomical location. They will only affect about 2 or 3 millimeters area, and not to miss any area, we do multiple section and stain it. And similarly in eyes, to get all the layers like cornea, then ciliary body, lens, and retina, sclera, all these subanatomical location will be available if you trim the eyes at tree level. Similarly, in inhalation toxicity studies, the nasal passage and all the lobes of the lungs have to be examined. And for nasal passage, uh, four levels are chosen. And when we take sections of this type, then all the changes present in the turbinates, then the olfactory epithelium, secretory epithelium, and the glands located in the submucosa is available, and any microscopic changes will be clearly uh, uh, appreciated and recorded. Now, types of species, study types and species, industry species, we examine, see, most of the laboratories has got facilities to examine pharmaceuticals, agrochemicals, all type of chemicals, and several species like rat, mouse, rabbit, dog, guinea pig, and monkey, and other species are examined. And types of study could be subchronic, chronic, carcinogenicity, both conventional type and transgenic mouse using, and reproductive toxicity studies, medical devices, inhalation and efficacy studies. And pathologists will be reading slides of animals exposed to variety of chemicals in different species of animals, and also of different duration. Now, developmental reproductive toxicity, DART, are juvenile studies. DART studies are crucial to protect vulnerable population, particularly pregnant women and children. Pathologists meticulously examine reproductive organs, developing fetuses to identify even subtle adverse effects that could have lifelong consequences. And in reproductive study, we examine fertility, sperm quality, estrus cycle. Then we'll conduct pathology of the gonads and the accessory glands. Then in juvenile animal study, dosing starts from postnatal day 21. Pathology findings on immature animals to mature adults is assessed. In addition to routine, bone length and density will also be analyzed. Now, for developmental and reproductive toxicity, the guidelines for ICH guidelines and OECD guidelines, these are the guidelines that we follow. Now, carcinogenicity studies. Carcinogenicity studies are conducted to appreciate if an organ is possessing the potential to induce cancer, that is carcinogen or not. And we do 2-year carcinogenicity assay in rats and mice. And according to OECD, FDA, ICH guidelines, the pathologist's role is of paramount importance in identifying and classifying these lesions, providing the basis for regulatory decision on a compound of carcinogenic potential. Now, in addition to that, we also do carcinogenic studies using transgenic RAS-2 mice. Now, earlier it was mandatory that 2-year CAR-C study in rat and mice are to be performed, but now it is accepted that 2 years rat study supplemented with most transgenic mouse study is acceptable by various regulatory agencies. Toxicologic pathology for medical devices, purpose evaluation of local and systemic tissue response, pathologist involvement during tissue collection, and trimming for proper harvest of the implant and reaction tissue is an absolute necessity. Pathologists should confirm that around the implant and the tissues around the implant is properly taken out for thorough investigation, and that will be extremely good. And the common pathological findings include mild inflammation, minimal fibrosis, and without any systemic toxicity. Sometimes the inflammation may be more, and even granuloma and necrosis can happen. And I told you, for medical devices, thin sections are very good, and we can take resin embedding section and evaluate precisely. Now, when the slides come to the pathologist, uh, before evaluating the slide, he will go through all the in-life phase changes like clinical size, body weight, feed consumption, then clinical chemistry, organ weight, and gross pathology, and toxic data related to toxicokinetics. Then, when after that, initially he evaluate high dose and control animals, and if there is any target organ, the tissues from these tissues from the lower group and also recovery animals will be examined. Now, when he is writing the integrating, then ultimately he integrate histopathology findings with all this in-life phase, clinical changes, biochemical changes, changes in the urine, all this he gets incorporated, and he makes a draft pathology report, which includes executive summary, materials and method, including fixation procedures, staining and gross pathology findings, microscopic findings, organ body weight ratio, group wise incidence, severity description, and ultimately, along with the table summarizing data, which include lesion, incidence, severity scores. Ultimately, pathologist incorporating all these changes, he will draw his conclusion, and sometimes, if needed, photography is also taken. And they also indicate some of the changes which are test item related, whether it is adverse or not, and to decide NOEL and NOAL and carcinogenic potential. Now, peer review procedures. Peer review, it is although not a mandatory by regulatory authorities, but it is preferable that our second pathologist look into your report. In fact, some of the sponsors insist that peer review should be done. And peer review could be internal peer review, external peer review, or sharing the whole image of the some, if there is a target organ, the whole slide image, scanned image shared through secure network. And external peer review could be a sponsor designated pathologist or consultant pathologist. It could happen on site or off site. And in our experience, external peer review on site is very advantageous for the simple reason that one-to-one discussion take place, and we can the whole peer review procedures could be closed within a week's time. Of course, in case if there is a lot of difference between the study pathologist and the peer review pathologist, and the outcome of the study is affected, then it will go to pathology working group, and whatever they say, that is the final. Now, basic concept in toxicopathology, that dose relationship, target organ toxicity, reversibility and irreversibility, adaptation versus back. Before we dive into this specific example, it is important to grasp these fundamental concepts that underpin all the toxicopathology. Understanding dose relationship is critical. Not every exposure leads to adverse effect, and the magnitude of the effect often correlates directly with the amount of exposure. Now, lesion and their correlation. Lesion could be degeneration, necrosis, inflammation, proliferation, hypertrophy, hyperplasia, fibrosis, and neoplasia. Toxic can induce a wide spectrum of morphological changes from subtle reversible alteration to overt irreversible damage and even tumors. No, these are lovely pictures for those who have undergone training or doing neurotoxicity studies. They appreciate these changes very well. And this is correlation with the clinical science. In life, if the animals have shown ataxia, tremors, and lethargy, then because the pathologist will initially look into all the data, as I have told you already, then he will get an idea something is happening in our system and he will concentrate. And I was telling you that not all subanatomical location will show lesion, and only some piriform cortex, thalamus, hypothalamus, amygdala, then Purkinje cells. These are some of the common areas where we will show neuronal changes. And what we are looking as dark cells, are they having condensed nuclei and the eosinophilic appearance of the cytoplasm. The periphery will show normal neuronal cells in the periphery. Some of the large cells in the periphery are the normal cells, and these are the ones undergoing neuronal loss. And I told you that in the peripheral nervous system, resin sections or HND sections are good, but if it is like small nerves like tibial nerve, sural or plantar nerve, thin sections of 2 micron resin sections tiled with toluene blue will give excellent real. In the second picture, what we are observing is swollen and degenerating axons along with demyelination. And in addition to the CNS and PNS, we can also see changes in the dorsal root ganglion sometimes. And dorsal root ganglion we take up in studies, neurotoxicity studies in the cervical, thoracic, and lumbosacral area. And you see higher magnification of the ganglion, dorsal root ganglion. And now, I have to emphasize a little bit on this here. Neurotoxicant can affect both CNS and PNS, as I have already told you, including dorsal root ganglion. Several xenobiotics, organophosphorus, acrylamide, notorious neurotoxicant like TOTP, TOCP, that is trialtolyl phosphate, trialsoprysyl phosphate in neurotoxicity. Addition to sciatic nerve, we also examine tibial, sural, plantar nerves, and in fact, we also in neurotoxicity we also do acute and delayed neurotoxicity studies in chicken. Now, again, correlation of clinical pathology with histopathology. Here, in animals which are showing threefold, fourfold increase in the ALT and AST, we will then immediately our attention will be on liver, and we looking for a single cell necrosis. And this single cell necrosis will be seen, multiple single cell necrosis will be seen. And again, correlation of hormone status with that of this thing. Now, in the first picture, we are seeing the epithelial, follicular epithelial hyperplasia. This can be seen as a consequent to changes in the hormonal level, or it could happen secondary to the hepatocellular hypertrophy. And most of the pathologists will be encoding hepatocellular hypertrophy due to high metabolic activity in the high dose group. And as a secondary changes, follicular epithelium in the thyroid will also be seen. No correlation with sperm parameters. If sperm parameters are affected, then the gonads will also be affected. Testis will be small. Epididymis will also be small. And in the histopathology, there will be atrophy of the germinal epithelium, and the epididymis will show absence or decreased or absence of the spermatids. Sometimes in gross pathology, we also record large testes, and in that, microscopically, we will see dilated seminiferous tubules. In these changes, we may or may not see changes in the epididymis. Then correlation of gross pathology with in lung. Now, grossly lung is showing multiple white foci, and microscopically it will show increased alveolar macrophages, and within the alveoli you see swollen macrophages. And in phospholipidosis, cationic compounds, these changes are very frequent. Sometimes in the lung we may also show large areas of cell proliferation. These are nothing but adenoma of bronchoalveolar epithelium. Now, if there is any lesion grossly noticed in the spleen as a foci or mass, they may show it as hemangiocellular adenoma, hemangioma, or hemangiosarcoma. Then correlation with gross pathology in pituitary. Sometimes when the necropsy is doing on, especially if this happens in animals which are aged more than 1 year, you will show enlarged pituitary along with hemorrhages and any white spot. Then microscopically, they are nothing but the pituitary adenoma. And pituitary adenoma do not metastasize frequently. Distant metastasis is unknown, and only local invasion can take place, and that happens to the adjacent brain. Now, correlation with gross pathology, whenever liver shows some of the lesions like white nodule on some lobes, then when we subject it to the microscopic examination, it may prove to be an adenoma or adenocarcinoma. Adenoma will be circumscribed and encapsulated, whereas adenocarcinoma will show trabecular type and necrosis and also local invasion. And in fact, sometimes it may even metastasize to distant organ like lung. Correlation with gross pathology correlation. Sometimes subcutaneous nodules are recorded in in-life phase or during the necropsy time, and this proved to be squamous cell carcinoma, fibroma, fibrosarcoma, or schwannoma. If it is female animal, it is common to note adenoma or fibroadenoma, adenocarcinoma of the mammary gland. Now, artifact is a artifacts are nuisance to pathologists as it comes in the way of slide reading, and proper training of the prosectors, histotech staff will help to minimize these changes and avoid misinterpretation of diagnosis. And artifacts can come up at any time during postmortem or during staining, fixation, staining, or sectioning, all those places it can come up. And as I told you, training of our histotech will help us to minimize these changes as far as possible. Now, here we are seeing some artifacts. For instance, the first picture is urinary bladder, and which is normal. The second is urinary bladder that proper inflation has not taken place. They have put the fluid into the wall, and therefore it is seen as a distended area. In this picture, we are saying intact hippocampal cells, but in the second picture, you are seeing the dark neurons. Now, whenever they handle nervous system, in fact, nervous brain should not be touched at all. Carefully, it has to be dissected out into the fixative. If they handle too much, then these dark neurons will come up, and whether to tell this as neuronal loss or dark neurons, it is difficult. And in this picture, what it is a artifact at the time of taking section, and a small piece of pancreas is within the vasculature, and this while in the what about this tissue remnant should have been there, and it has been accidentally picked up and stained. No hepatotoxicity is several new liver has high metabolic capacity that it makes vulnerable for several xenobiotics to act, and liver central lobular necrosis, it can hypoxia, carbon tetrachloride, tannic acid, chloroform, and many hepatotoxic agents can cause this necrosis. And kidney is another organ which is commonly affected. Glomerular, then tubular system can also affected. This is a picture because high in kidney, high blood flow concentration of toxins is the reason for changes, microscopic changes. And here is an example of papillary necrosis caused by non-steroidal anti-inflammatory drug. Now this is a picture of lung showing alveolar macrophages in the now again heart can also show changes, heart necrosis, cardiomyocyte, and it can happen due to various test compounds. Doxorubicin and cocaine and catecholamines can cause these changes. Here you are seeing necrosis of some of the myocardiocyte along with inflammatory cell infiltration. Now this is a section of bone showing the normal bone, and the other one is showing total acellularity. Bone marrow suppression, example, chemotherapy agent, benzene, then several anti-cancer agent, radiation, heavy metals can cause these changes. Now here, this is reproductive toxicity, where in which you see condensed round spermatids, the testis degeneration of germ cells, spermatocytes. This is in stage 7. Now, emerging technologies in toxicological pathology, like digital pathology, that is force light scanning, artificial intelligence, and machine learning. And these are the uh, uh, coming up new tools for pathologists. Now, challenges in toxicological pathology, complexity of mechanism, low dose and chronic effect, extrapolation to human beings, ethical consideration, resource intensity, and data over data. Now, despite our advancement, several significant changes persist in toxicological pathology, unraveling the effect of complex mixtures and very low dose exposures, and accurate extrapolating finding to human beings remain active area of research. So summary to key concepts. To recap, toxicopathology is a dynamic and essential discipline. It is about connecting the dots between exposure and the effect, using a meticulous scientific approach to ensure safety and also advance our understanding of toxicity. Now, why European adminers alone? Here you see the number of pathologists, their qualification, experience, ability to handle several species of laboratory animals, type of chemicals, and ability to perform standalone anatomic and clinical pathology work, routine use of international glossary, including SEND nomenclature, presence of extensive historical data of control animals for different species and of different duration, availability of digital pathology, whole slide scanner for remote discussion and digital peer review. And actually, in this facility, European Advenus, synthesis to submission, we can do all studies, one-stop shop for digital development from synthesis to submission. Again, why European Advenus alone? See, European Advenus can take up studies to handle a variety of chemicals. It is a GLP complaints and turnover time is very fast. It is a GLP facility audited by FDA, several other agencies, include accredited vivarium, and all their studies will be ethical review of all studies is done by IAEC. Then the facility has got large number of study directors who are well qualified and experienced. Note the number of different type of studies completed, including 70 carcinogenic studies. These figures are really mind-boggling, and the pathologist, the study pathologist, the scientist of the Advenus, the QA people, and the management should be proud of themselves for such an amount of data. And if somebody wants to give a study, European Advenus is a force to reckon with. Thank you very much for your patience. If there are any questions, I'll be more than happy to answer.
Thank you so much for the presentation. Dr. Sarthi, there are a few questions here, so I will go with them in the first order. Somebody wants to know that there are many clients from the US who are asking mostly for ACVP certified pathologist for peer review. For Indian pathologist, is there any equivalent to the ACVP certifications?
No, ACVP certification, we have one Dr. Madhusudan in India who can take up, but European Advenus, we have sufficient experience and knowledge to take up peer review of any studies or even conduct studies.
Right. So, as far as the education and certification for Indian pathologists are concerned, there is nothing equivalent to an ACVP.
No, see, we our Indian IBTP, that is Indian Board Certified Toxicopathology, we conduct, we have enough experience, and the exam that is conducted, it includes both theory and two practicals, and it is a very comprehensive examination held, and in fact, they have the candidates should pass all the three parts to become qualified as a diplomat, and it is and whatever there on par is ACVP is there.
Okay, right. Um, and then we have another question where they're asking, is there any correlation between uterine stromal atrophy in PND 15/22 DAM histopathology, which were also showing decrease in terminal body weight, or any correlation with normal involution process?
That's what they have to differentiate, considered as a involution. They should consider as it involution should be correlated with the various parts of the ovary and also various parts of the uterus and cervix and vagina.
Excellent. Right. And then we have another person asking us, can pathologists from the medical field of work, can pathologists from the medical field, so that means like a MD, pathology doctor, work as a toxicologic pathologist?
Yes, they can act as a toxical in toxicopathology, but he has to have a sufficient exposure in the various animal models, the various type of lesion observed, all those things. In medical pathology, they are more interested in taking biopsy and getting diagnosed. But in veterinary toxicopathology field, this amount of information examined, organs, so many organs examined, so many different animals examined, the different duration, then so many chemicals being examined, the medical legal people may feel it a bit wanting.
Got it. And then we have someone asking us, is there a standard procedure for pathology peer review?
Yes, I told you pathology peer review should be uh, uh, answer the internal peer review or external peer review or peer review through digital pathology, a picture exchange through secure network. These are the different type of peer review. But peer review could be can be done if the sponsor or somebody wants in the in-house peer review by a senior pathologist. And in case the sponsor designated pathologists or consultant pathologists are peer reviewing, it could be on-site or off-site. And on-site peer review, I told you, it will be very good because one discussion can take place and the peer review procedures could be completed. And in short term, that's all. That is about the peer review.
Right.
Any further details if the person wants? This is what happens throughout the world.
Right. Right. And then I think we have somebody who's very fresh in pathology because they are asking us that if you've joined as a fresher in this industry, how can one gain experience in toxicopathology? Is there any workshop or courses they can attend?
No, I told you that a fresher joins the uh, facility. They will be given intensive training in the laboratory animal pathology for 1 to 2 years, and both in gross pathology and microscopic pathology and other activities of the Department of Pathology. And before allotting the studies, and in fact, they will be made to read the previous studies if done by or some studies are going on. Those tissues will be given and asked to read, and after ascertaining all these details, and when we feel that they are learned the skills of diagnosis, both gross pathology and microscopic pathology, they will be allotted independent studies. And even after doing evaluation, the entire pathology will be reviewed by the senior pathologist to confirm that they have learned all the skills in pathology.
Right.
And apart from that, as I have already told, there will be various scientific seminars, workshop, and conferences happening, and deputation of them will make them to learn what are the latest technologies adopted and what are the latest development, and they can enrich their knowledge.
Perfect. Perfect. Then we have a question. Sir, how do you evaluate the germ cell in DART study in female? Please suggest the method. I don't know.
Females. Now counting the CL. Hello, that is a. Some echo is coming. Now that is you can female reproductive system evaluation in toxicopathology. What exactly is the question?
How to evaluate the germ cell in DART study in female? Can you please suggest the method?
1 minute. Kamala is going to answer.
Yeah, hello. I am joining Dr. Vijayasarathi to answer this. So, the exact germ cell degeneration, which is in the most particular area of ovary, it would not be very accurate to detect. So, in the rat studies, rat is the species which is commonly used for the DART study. There, since the cycling time is less and the animals are cycling more frequently, by examination of follicles and also by the CL counts in case of pregnant or the lactating animals, we can assess the germ cell degeneration to some extent, and also the toxicity of growing follicles can also be assessed by examination of the primordial and primary follicles which are present in the ovary by doing a serial sections of ovaries and do actual counting. So we should do a quantitative procedure.
Thank you, Kamala.
The candidate can come back to us if they need a detailed procedure on that. We are happy to.
Sure. Yeah.
Yeah.
Yeah. Thank you, Kamala. And then finally, I think this question had to come up in the world that we are today. So, how are we with AI? Are we using AI-based algorithms for toxicopathology evaluations?
Now it is in the initial stages, and we feel that it may take up pathologist role in future. But all said and done, for now, the pathologists are comfortable with whatever availability. Now, digital pathology feature sharing with SecureNet is the one that is happening all over the world, and
Right.
artificial intelligence is in the beginning, and what is going to happen, we can't forecast as of now. Maybe we don't know. The world is fast changing, and pathologists may become defunct.
Yes. So for regulatory studies which are submitted on the repeat dose toxicity studies, still it is no. However, in the efficacy studies or in the initial stage of any drug evaluation, where animal models are used and we need to quantify some findings like liver fibrosis or lung fibrosis models, there pathology tools are in market which can be used and quantify the extent of lesions.
Anjali, I would like to add that as of now, pathologists have absolute requirement. Without pathologists, toxicopathology cannot happen. And whatever the artificial intelligence it will come, it is only going to be complementary, and pathologist is going to be in business forever.
Yes. Yes. All right. I think those are all the questions we have. Thank you so much, everybody, for your time and joining us. Thank you, Dr. Sarthi. It was a very insightful session.
Okay. Thank you, Anjali.